Hello, my
Hi.
name is Dr. Susie. I'm one of the dentists here. Can you just confirm your name and date of birth for me?
Yes, it's Jenny Barnett, and I was born 4th of March 1956.
Lovely, thanks very much, Jenny. How can I help you today?
Well, I've had a really bad pain, left tooth that's rotten. It's gone bad. So I'd really like to have it taken out. It's causing me a lot of pain, eating and sleeping even with the pain. So I'd really have to have it taken out. But I'm a bit worried because of my medical history. I'm known to have an irregular heartbeat. So I'd need to know how that would affect with my medication.
Certainly, I understand we need to take that tooth out, so we're on the same page about that. It would be very helpful if you could tell me more about your heart condition. What medical problems do you have?
I've got a history of an irregular heartbeat.
Okay, and are you taking any medication for that?
Yes, I am. I take regularly dabigatran, 5 milligrams of almopidine, and 40 milligrams of simvastatin.
So the statin that you're taking will be to manage your high cholesterol that we've noted in your medical form. And thank you for confirming as well that you're taking amlodipine, which will be for some high blood pressure.
Okay.
I understand that you're taking the dabigatran for your irregular heartbeat. Have you ever taken any other sort of blood thinning medications? Have you ever needed anything else?
Not now, but 5 years ago, I had a blood clot, and I was put on for 3 months rivaroxaban.
Okay, and was there a particular event that triggered the blood clot? Was that a deep vein thrombosis?
Yes, it was after a flight. I'd gone to Australia.
Yeah, so they can happen after long flights. And you mentioned that was 5 years ago.
Yeah.
And was that quite a short period of time that you took the rivaroxaban? Has that completed now?
Yes, I was only on that for 3 months.
Okay, so we don't need to think about that in terms of your extraction now. We can put that behind us. But the dabigatran we need to consider. Do you have any other health conditions?
No.
No. And do you have any allergies that you're aware of?
No.
No. Okay. So with your tooth, you've rightly mentioned that you're awaiting an extraction for that, and we just need to manage that in the safest way possible. Your dabigatran is a blood thinning medicine. You might have noticed that you may bleed and bruise more easily than you used to. And the reason that you're on that is to prevent a stroke, given your history of high cholesterol and irregular heartbeat. So the risk of what we don't advise is stopping that medication prior to a straightforward extraction, because the risk of stopping it would potentially be that you could have the potential to have a stroke. So what we would tend to do is advise you to take all of your medications as normal.
Right.
Because then your risk is bleeding, which can be managed by us in the practice.
Right.
Okay. So things that we can do in order to manage the bleeding would be things such as immediate sort of local measures during the extraction. So just extracting the one tooth, which is all we need to extract. Assessing the radiograph so that we know that it looks like it's likely to be a straightforward extraction. So we can use an atraumatic extraction technique. So hopefully it'll be straightforward, uncomplicated, and not a big trigger for bleeding.
Right.
And then other things that we have at our disposal are things like what we call hemostatic agents. So a sort of material that we can put into the socket once the tooth is out that encourages a blood clot to form. And then over the top of that, I can pop a stitch, a particular kind of stitch that will just draw your gums together to protect that clot and to maintain it in place. And we'll use some pressure over the extraction site as well that will help to stop the bleeding. And our local anaesthetic agents also have adrenaline in, which will help to stop bleeding locally as well. The other thing that we can arrange on a more sort of a general practical basis, and what we can do today, is ensuring that the extraction appointment that we give you is at the beginning of the day and at the beginning of the week as well. So if there are any complications, we're there all day, you can call on us. So what I'll also make sure I do on the day is to keep you a little bit longer than perhaps somebody else who might have an extraction. And the reason for that will be to really make sure that that clot is stable, that you're not bleeding afterwards, and that there's a low risk of you bleeding again. So we can, the other thing that I'll do is I'll give you a leaflet that has information about bleeding on it and these medications, and you have our phone number as well. As I mentioned, we'll do you at the beginning of the day, so if you have any problems at all, any concerns, you can call us and potentially reattend during the course of the day if you need to, which I hope you won't. And if you have any problems out of hours, this leaflet will also state what the emergency contacts are, and essentially that would be, if you're really bleeding, to go into your local emergency department. Do you have any questions about any of that?
No, my main question was about the bleeding, but I feel reassured that I'll be in safe hands.
Oh, great, yes, yeah, good. So we'll take the local measures, we'll take the practical measures of getting you in the diary in the correct place.
Okay.
The most important thing for us will be to create a nice, stable plot. We'll make sure that that's in place before we let you go home, and you'll have all the information in front of you if you do need to reattend or attend somewhere, if you need to. All right.
Thank you.
Thank you very much.